Now that you've reviewed the normal anatomy and physiology of the abdomen, let's make it specific to health assessment. One of the first things we need to do is figure out a standard way to talk about the abdomen when we're charting or talking to our colleagues. So most people divide the abdomen into these 4 quadrants. We have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. So if someone is complaining of abdominal pain, or if we palpate a mass, or if we hear unusual bowel sounds, we can document where we had that finding. A less common way to divide the abdomen up is into 9 sectors instead of 4. People call these the 9 regions of the abdomen. The main 3 that most people use are these in the middle here. Number 1 is the epigastric region. Number 2 is the umbilical region. And number 3 is the hypogastric region. People don't usually discuss the regions on the sides here, but just as a matter of interest, 4 and 5 are what is known as the hypochondriac regions, meaning below the ribs. And in ancient history, people thought that bad humor collected here under the ribs. So if somebody thought they were always sick, they were focusing on their hypochondriac region. Hence, when we call somebody a hypochondriac, now you know where it comes from. So once we've decided how we're going to name the regions of the abdomen, we also need to make sure we know normal variations for special populations. So if we start at the beginning of the lifespan with the infants, the first thing to know about is called meconium. And this is the first stool that a baby has after birth. It's a thick, black, tarry stool, and it's normal for an infant to pass that stool within the first 24 hours of life. If they don't, then that's actually an indicator that there might be something wrong with their GI tract. The other common finding is a big liver. Not that it's big for the infant, just that you can obviously feel that liver below the costal margin, which is unusual in an adult, but for infants it can be perfectly normal. Pregnancy also has several unique findings. First one is called a linea nigra, and this is a black line straight down the middle of the abdomen and lasts throughout the pregnancy, then disappears when the pregnancy is over. The other finding on the skin is called striae, and these are commonly known as stretch marks. I'll show you pictures of both of these in a second. Lastly, remember that everything just gets moved around in there. So the stomach and intestines are sort of pushed out to the edges of the abdomen. So when you're listening to bowel sounds, you'll have to go more towards the edge. This also can cause things like heartburn, nausea, vomiting, constipation. So there are lots of GI complaints that go along with being pregnant. Here's that picture of the linea nigra I was telling you about. You can see it starts way up at the top, comes all the way down. And then here are the striae. Young women can also get these during puberty when their pelvis and their hips expand pretty quickly. Older adults have a couple of unique concerns. Firstly, we see delayed gastric emptying. So it just may take longer for a patient to be hungry again after a meal, especially a large meal. There's also an increased risk of gallstones, so we'll pay special attention for symptoms indicating that concern. And then there's also an increase in the incidence of constipation. Now, this isn't an automatic concern with aging, but there are several factors that probably contribute. First, most people have decreased physical activity, and because of a decreased thirst sensation, also a decrease in water intake. Along with that, many people are taking medications that can also cause constipation. So with this group of factors all working together, many older adults do complain of constipation. Lastly, just 2 cultural or genetic concerns to be aware of. Firstly is lactose intolerance. We know that lactose intolerance is caused by a decrease in the enzyme lactase that breaks down the sugars in milk. And although there are certainly genetic factors here, the more we learn about it, we realize that lifestyle also has a lot to do with it. Somebody who drinks a lot of milk or eats a lot of dairy products will naturally build up more of this enzyme, while people who avoid dairy products altogether lose that enzyme activity and can actually increase their lactose intolerance over time. We also want to encourage people to get enough calcium in their diets. So even if someone is lactose intolerant, we still want to make sure they're eating some sort of food that contains enough calcium for healthy bones. The other factor to talk about here is obesity. This is obviously a lifestyle disease as well, but we do know that there are genetic factors at play. So obesity can run in families, and underlying causes of obesity can also run in families. So we certainly want to assess a family history as well as a personal history in this case. Speaking of history, it's time to move to the next video where we discuss all of the subjective information we gather from our patients.